regarding the different parts of it, we'll talk about. Okay. Right. So what are the things that you need to consider? So I'll be giving you feedback basically as a reviewer, right? So things that we look for or things that are problematic when we get manuscript for publication. Now, my assumption is that most of you would be at the early stages of publication or writing, or maybe new or have one or few publications. So these are things that will be helpful when submitting for publication, whether in index journals in Pakistan or abroad. Now, first, just before you, this is one of the difficulties. And I'll let you know that the first article that I had from Aachen when I was there, it was a study that we did in which was published finally in a good journal and now has over 300 citations. But it was rejected by 2 journals before it was finally published. And it was done through with Dr. Steve Luby, a very famous name at Community Health Sciences some time ago. And so it took about 2 to 3 years to publish, right? So it's doing the research, writing the research are 2 major things. But one thing that you should realize at the beginning is that getting it published is also a 3rd major step in getting this done. So the first thing that you should do is always select the right journal, right? So level, get your manuscript reviewed by someone senior. Look at some of the things that the level it may be there. When we do a research, we always think it is the best, right? Because we have done our best to do that. But unfortunately, that is not the case with the reviewers or the editors that are there. They're always there to chop down our work, and it becomes disappointing at times as well. So you have to consider the journal, see what type of articles they accept, look at the published articles in the journal, whether they're similar to the ones that you are thinking about. Now, the study design, sampling, and statistical methods should be according to those journals. So they'll according to it. You have to think whether your topic is interesting for a local or an international level, right? Then is it relevant for a journal or a specialty journal? Depends on which medical field you are there from. And finally, one of the things that we have these days is the open access, and then journals that are subscribed. Now, usually you have to pay for publication in open access journals, and subscribed journals will accept it with minimum payment or no payment, but they're difficult to get published. And those are the good ones like BMJ, JAMA, and those kinds. Even JPMA will be among those parts. So, and one thing I'm sure that most of you must have been aware of is during this last 1 or 2 years, there's been a lot of issues regarding unethical publications. And so there are a lot of parasitic journals and which need to be avoided as well. So please I'll show you a tool later on that is helpful in selecting the right journal. We'll do that at the end. But we go, this is the one that is I normally use. The other ones as well is journal author name estimator, and we'll go through this website later on. Now, this is another one. This is for observational studies. What checklist that is there, I'll be sharing this with you as well. If we follow the points in this checklist, make sure that all of those points have been addressed, then you have a better chance of getting published or getting accepted for publication within that, right? It's strengthening the reporting of observational studies in epidemiology. Most of our studies that we do are observational. But if we are doing clinical trials and those things, then consolidated. The other checklist is consort. which is similar, but we'll just be focusing on the stroke checklist for today. Now, the most important thing, I mean, this is many of my students and even most doctors, we fail to read the journal guidelines. I usually, but whichever journal that I'm targeting, I download the instructions, I print it out, keep it in front of me, mark it, read it at least 2 times or 3 times before finalizing my manuscript, right? What other things that we need to look at is what type of references, what the referencing style. Now, it's something that is neglected, unfortunately, but these are things that are reviewed by the editorial board first, right? So what are the instructions for the references? The tables and figures, how to be configured, what is the number of words that is required, what is required, line spacing, font size, and all of these things. Now, why I'm emphasizing is by the editorial board. And most of them, before going to a reviewer, the editorial board looks at it whether the submission has the good of the good journals, but whether you followed the instructions or not. So if you don't, then be rejected. And about in the good journals, more to see because that's okay. These are just basically the journal criteria that they look at in terms of the reviewing the article, the relevance to the journal, whether it's originality, written well, right? Now here in Saudi Arabia, our students, again, the first language is not English, so English writing needs always improvement. So they do have and there are editing services available, or you can get it reviewed by some of your colleagues who may be better or have it reviewed by someone. So make sure that it's written well and also right, timely, that when it was done and when it is being published. Now, unfortunately, many of our researches from the time it's completed to the time of publication takes at least 2 to 3 years. And rigor is how much you have put into that. That I'll give you some tips on how we look at it, importance of to the journal, ethical considerations, and finally, is it interesting or not? Now, one thing that you'll see is definitely missing over here is statistical significance. So a journal results don't always have to be finding some significant p-values and those things to be published. So even if you are saying something was not significant, will contribute to the literature as well. So don't worry about if your results are not going, all of them significant, don't have too many values, significant values over there. Now, the key question that you need to consider is who is the article written for, right? Who's your intended audience? What is the study trying to achieve? And what was done and how? And what were the main findings? But the most important thing that the reviewer will be looking at is so what? So you've done all that. We have put in a lot of effort. So what are the implications of the findings from this research, right? And good to have it reviewed by someone from outside your research group who can look at it critically, and this will help you getting your research getting published in a more timely manner. This is, as I mentioned, that what the editorial review looks at. Is it in the style required by the journal? Is it relevant to the journal's mission or the readership? Has a similar study been published before? Are you adding something to the previous literature review? So that is why literature review is very important. Make sure that you have done a thorough review, and make sure that when you're writing or in your cover letter to the editors, you emphasize what your journal, what your article or research is adding. It may just be something that this was study was not done in Pakistan. So it's something that is being added from a different developing country over there, right? And also, as I mentioned, writing, referencing, formatting, and those things seems minor, but when the editorial, if they don't like it, they may reject it outright. This will just go through quickly. I'm not going to be talking in detail about different parts of it. It will be more in the writing workshop that you take. But as you know, all the title and the abstract, right? So title, when we write the title, it has to be, now I'm talking from the reader's perspective now, that the title and abstract are consistent with the journal guidance regarding word count. And I'll show you a template that is later on over there. Make sure that the title and the abstract match up and are related to each other, because these are the two things that are reviewed by the editorial board. And also, unfortunately, most of the readers, reviewers, or people who are going to cite your article, and it is unfortunate, but they don't go beyond the abstract. If someone is really interested in your research, then they will go through it. But that will be like 1 in 100 people who actually go read the abstract. Now, I'll be talking about something later about abstract conclusions, right? Do they accurately represent the outcomes that are there in the whole manuscript? And p-values, absolute numbers, and those things that are there. And if you put appropriate keywords, that will help your article in being cited better, right? Word count is very crucial. Most of the journals have a limit of 250 to 300 words, and trying to fit everything into that is a challenge. And when we talk about the abstract later, it should be focused, start from the conclusion, go back to the results after that. I'll just leave these slides. The copy of this presentation will be available, so we are not going to try and go through everything. But when we come to the introduction, one thing that I always mention is the introduction is based on secondary review. It shows how rigorous you have been in your literature review, how well you have looked at other papers, and how you have identified what is known, what is not known, and then that establishes the rationale, right? And it should be supported by relevant and recent references, and generally some local references as well, especially if you're publishing in a local journal. Why is the introduction important? Because if, as a reviewer, I will not look at the abstract first. I will start reading the article from the introduction, go to the end, then go back to the abstract to see whether things have been covered appropriately in the introduction or not. The editors will look at the abstract first. Now, when I'm reading the introduction, now remember, your article will be sent to someone who is an expert generally in that area. He or she will know what recent papers have been published, and that reviewer might have published an article themselves on that. So if we miss out on the recent publications or some of the important publications, according to that, will come out as a missing link in that. One of our senior editors of medical education in a workshop, he once said a long time ago, 10 years when I was attending a workshop, he said that when he starts reading a manuscript that has been submitted for publication, he looks at the references first. That was something new to me. And I said that I don't buy that. He said, try it, and then let me know. So after 1 year, I wrote to him, yes, it is important. So if you look at the references, you have an idea of how much the authors have put in the rigor in the trying to do the literature review completely, right? Don't try to get too much in the introduction as a lecture. Present the general introduction and what is has been published on this, right? And at the end of the introduction, you should always state this is in the last two sentences, the aim or the purpose of the study, or if you have a hypothesis, that should be there. Remember, if the introduction is written well, then the reviewer will get a good impression, the first impression. But if the introduction is not written well, then the next sections, even if the results are very good, by the time he gets to that, he will have developed a negative attitude about your article. So there will be more objections. So English writing, flow, paraphrasing, avoiding long sentences and giving appropriate references is very important. Length, I always say, should be about 600 to 800 words, which is, if you are using double line spacing, it's about 2 to 3 pages in a normal time. Right, so make sure that you have that, and 3 to 4 paragraphs. That's good. Methods is very important. It generally this decides what type of journal it is going to be published in, how rigorous you have been in doing the sampling, sample size estimations, what about any randomization if it was required or not, identifying the correct groups and the correct population for doing the study. I generally consider the method section as a recipe, a menu, right? So it's something that if someone else can reproduce your study in their own institution based on what you have written, then it's a very good method section. Think of that. And at the end of the method, you should mention the questionnaire or the data collection instrument you used, any operational definitions. So this is something which really determines the quality of journal that is going to, not the results, but the methods will determine the quality of journal which is going to be, whether the result is generalizable or not, whether you followed the good statistical methods or not. So at the end of the method section, there's always a paragraph for the statistical methods used. Generally not that difficult for us to write, but for the new people it is there. But make sure that you mention what statistical terms the test you have used and those things, and the program that was used on it. Especially if you've used any new or different statistical test. Right, how many subjects increment, those things, compliance and those things will do that. And for trials, you have to be more rigorous about how the subjects and the controls were selected. Results will vary with different articles, with the type of study design that you have done, whether it's an observational, interventional, or a comparative study, right? Usually, when I write the results, I prepare the tables first. About 4 to 6 tables are there in all articles that are published. I then write a paragraph for each table, maybe the 2 tables in one paragraph at times. I use figures for the important point that I want to reproduce in my things, because people remember that in a much better manner and they can observe it. Too congested or cluttered tables, you may have seen them in different publications, but they are distracting. So try to keep your tables simple, easy to understand, and they should be standalone. The people should not have to refer to the text to understand the table that is there. That is the most important. And the table should not be repeated in the text, but definitely there should be consistency in what you have done. So always in the instructions, see how many tables, graphs are allowed, right? Within that, if you have excess, there's now, especially with the online journal, they have got an online supplemental data. So you can put them in as additional. Don't try to stuff everything into the results section. Keep the relevant part, especially those that were related to the main aim and objectives of study. Now, the discussion section is probably one that you should be writing if you have got a senior supervisor or someone in the field, because the discussion section is basically interpreting and making sense of the results and the implication. At an early level, we are not maybe able to fully understand why our results are different from some other study or similar to the study, how they add or contradict to other studies that have been there, and what are the implications for practical part. One simple thing is, please, based on whatever study we do in any institution, even in Afghan and Pakistan, we should not try to go overboard in generalizing our, trying to make that earth shattering things. We have to be really follow humility, try to see what are the limitations of it, right? So there will always be confounding factors, some limitations. Mention the limitations of the study that you have observed rather than having a reviewer identify those limitations. Finally, as I mentioned, avoid excessive wordiness, right? Um, so don't use information based on your own experience or your own opinion. Try to avoid that. If you are doing that, mention that clearly. Differentiate your opinion from your inference of the article. The conclusion must be based on what you have found in the results. A lot of people, especially in the beginning, in the conclusion, they write things which they had initially perceived, right? So do not try to oversell or significance or try to expand the results from one institution to the whole world or even to whole of Pakistan. Avoid, again, as I mentioned, avoid excessive generalization, those things when they and finish with were recommendations for improvement with for future studies and what would be the implication for them. BMJ has a good box if you ever look at it, in which they mention the key points from the study. So try to follow that as a guideline for that. References, as I mentioned, if you are using a software, EndNote, Mendeley, Site Value Write, whatever, there are different ones available, is very useful. Make sure that you try to get the references checked by another person. I especially recommend getting the help of a librarian or bibliographer if available. I'm sure that in Aachen you have those facilities, not available everywhere, but make sure that your references are in a consistent manner according to the referencing style that they're there. But one thing that even if you're using a referencing software, I found that there are still mistakes, especially when we go from online journal to a published journal or to a website or those things. So make sure that you check the referencing format or get it checked by someone. Cover letter is good. When you're submitting for publication, uh, you can try to emphasize on it things which may not be clearly evident from your uh, writing in the text. It is written to for the editor, right? Sometimes if your article has been rejected by another journal or it has been late or it is part of a thesis or something over there, it's good to mention that. You have to mention in that one very important thing that you have to follow is that you cannot submit an article to two journals at the same time. So you have to mention that it has not been submitted to any other journal and your copyright things are not there. And any changes that you made after any previous rejection, this will be helpful for the editors and do that. Okay. So this was the basic. Any questions on this before we go to the next? The public, so someone mentioned what was mentioned before the stroke checklist. I'll have this presentation available, right? I'll just now go into the other parts of it. I'm just looking at the chat. Now, I'm going to be sharing this. I will not be going through this in detail, but this is a very useful handout, 9 pages, no, in fact, less. There's joy of writing a paper. I'll just make it a little bit bigger, right? So most of the things that I've mentioned over here are in this. Is my paper, the journal, the authors, what are there. Um, the good thing about this is, right, they talk about split the thinking from the writing, right? This is especially when you're going for writing for publication. Make these boxes about what you're going to be putting in the introduction part, for example. And then put some references for each paragraph by the side. I never tried this before reading this article, but after that I started doing this. And what I found is that it helps me in organizing my references more judiciously. I can then say, okay, I'm not overusing a single reference and I'm using my references appropriately within this. I'll talk a little bit about references. Is that normally when we write an article, there are about 25 to 30 references that are overall accepted, uh, allowed by the journal. Now, out of these, uh, if you look at journals, I'll share the template with you. About if there are 25, then about 12 to 15, about 15 references are there in the introduction, but another 10, 8 to 10 new references are added in the discussion section. So don't add all your references in the introduction, keep some 4 to 6 for addition in the discussion section. This is something that reviewers will look at. Now this one has good for each section, introduction, right? These boxes at the beginning of each thing, what are the different, these are generally what are the paragraphs and components that should be followed. So introduction generally follows a specific formula. Methods, right? Again, what are the points that you need to, in what sequence that is there. And gives what, like for each box, what should be written within that. So I'll be sharing this with you all as well. The results, generally how what to start and how to spend that and what with the expected observations. And finally, the discussion, right? So these are the different parts in this order. Preferably, if we do that, it will be good. Now, one advice that I got, which was very useful and which I try to convey, is that if you want to be a good writer or publish, then the most important thing is for to be a good reader, right? So the advice that was given to me was read one article every day. So I agree that for all of you, especially in the clinical side, it may not be that easy. I remember when I was there in Aachen, I was chief resident at that time, Dr. Zafar Nazir. He always had one article in it. It was before the days, the 1990s, right? Before we had the internet and the online facilities available. So he always had to have something from the library. And he always had a new article in his hand. And we were discussing then journal clubs are very useful for developing our thinking about how to write. The more you read, the better. Try to see how the others are writing, what are the templates, what is the organization of the paper, right? So that's the best advice I can give you, that if you want to be publishing, look at other articles similar, try to follow their template, right? So the discussion is discussed in detail over here up to the conclusion. And abstract is the last thing that you learn, right? So in the abstract, you have to basically give these, you don't give the literature review, you don't give references, you just give the rationale and the objective of the study. You focus on the study design, basically the methods. Now the results that you mentioned, the abstract, I always recommend write the conclusion first, 2 lines. And make sure that whatever is the conclusion, that result has been presented in the over there. You don't have to present all the results, but at least those that you're giving as the final conclusion, make them out. Okay. Revision. These are the things that you get, right? Revision, rejected, accepted. Hopefully, if you follow the correct things, mostly you will always get. There's very few that papers get accepted at the first go. But if you do some of the revisions that have been there, another advice, the reviewer is always right, even when the reviewer is wrong. Right? So you may not agree with the reviewer's comment, but since the reviewer is looking at the paper from a critical, trying to understand it, if he or she cannot understand it, then the readers will not be able to. So make sure that you revise based on it. If there's something you cannot revise, specify that clearly and the reason for that. Even if a paper is rejected, right, don't worry. It happens. I mean, even to I have over 100 publications, but still my paper will get rejected from. May not be written well, may not be suitable for the journal, may be duplicating something already published recently, right? So you have other options and you go there. So always target. So I will share this one. Now, just a quick one for this is, this is the website that was talking about journal author name estimator. If you have anything, any topic that is there, I'll just take one of my studies. Right? So put the title. Right? So whatever title, if you can put the abstract, that is also good. And you just go and click on find journals. It gives you a list of journals based on matching with your topic that you have, right? And it gives recommendations. And over here, you will see that it also gives that PLS one is open access. It is Medline index. It is in PMC, and how not the impact factor, but the influence. Impact factor, you'll have to look it up yourself, right? Unfortunately, it does not tell you whether it's a paid journal or how much or how long it takes. You have to go to the website. But I found this to be generally useful, both for literature review and for choosing this. So normally what I'll do is I'll look at the first 5 or 6, think of which one I would be targeting based on how good I feel my article is. And I will start submitting it to the first one. But I'll always, at the same time, look at the second one to submit in case it gets rejected from there. Right, so do try this one. I'll send the link for this website as well. This is the checklist, strobe, right, for observational study. It has, most of the journals follow this, almost 80% of this, and they may have something extra with on. So if you have made sure that you followed all the things that are given as this points, you have a better chance of getting your article passed through the editorial board and going for the, right? So it has everything from introduction to the final parts. Should we have questions? Okay, just one more thing that I'll be sharing as well. This is just a 4-pager. Everything that we've talked about, successful scientific writing step by step. It just gives a summary of everything in one page that is useful to keep and paste on your desk next to you. When you're writing, keep it over there. And then for the public, that was for writing part. This is when you're submitting it to a journal, what are the things that you need to do, and when the journal is right. So this is something I found to be useful for people even at this stage that I'm writing. Keeping these points in view will be helpful. As I mentioned, publication, submitting for publication, getting accepted is a major step, sometimes more disappointing than the research itself. Right. So these are the different steps. I we don't have time for this, but I'll just share my final thing with you, and we can have questions over there. This is one of my papers. This is on sample size estimation sampling techniques, published over here in the Saudi Journal of Health Sciences, specialties. And it interestingly enough, it got a lot of citations from the different parts of the world. Now, it was written as a for residents. There are other 3 or 4 other papers in this series that are talking about study designs and statistical methods. I will share all of them for that you can have them, or you can just Google them up and Google. You can get them. They are free, open access, so you can download them. Basically, this is something that when I started over here, I found that this was one of the major weaknesses, which was holding people back from publication in good journals. One is we don't do the required sample size. So sometimes we have a less than optimal sample size, or rarely we go overboard. So both of those things are, we need to have get a statistician on board before you. And sampling technique for getting a representation to generalize. If you're doing a study in the Khan University, you cannot really generalize to civil hospital or even to an institute in Lahore as well, right? So make sure that your target population, study population, target population is the one that you're going to generalize to. The study population is the one from which you're going to take your sample, and your sample final that you get are representative of each other. So don't try to generalize your study results beyond that. Okay. So this will, I'll just show the easy written for residents, Saudi residents, to help them publish. With the requirement that was given to me was it should be easy for people to understand with examples, like in over here, what is the difference that you can expect over here. Anyone has questions on these articles, you can free to contact me directly. But the best thing I found was the references at the end with software for doing the sample size and other things are given at the end. Okay. So if any questions that are there. I mean, if anyone has a question, please just, because I don't have the chat screen available. So if someone can read it out for me, Simil, if you can do that.
Sure, Dr. Amir. As soon as I believe we get the questions, I'll read them out to you.
Okay. Meanwhile, I just showed this 2 templates as well. This is something I do as a workshop over here. The writing the title, right? So seems easy. What I do is I give out, you can do this at home with this template. Take any 5 articles that you feel are good, relevant to yours or similar to yours, or from the journal that you're trying to publish. If you follow these things, you will find this is one of the commonest questions that is there. How many words? So just look at different articles in the journal, see how many words they have used, right? Think about, does it seem interesting to you? Does it give a good idea about what is included in the research? Now, these are things that reviewers will be thinking about. Now, does it specify the following? What was done? Generally, this is always there. How it was done, study design. If it's a higher level, like a cohort or clinical trial or case control, mention it. If it's an observational cross-sectional case series, no, maybe not really required. All of these are not required. Just think of what is there in the articles that have been published, and that will give you an idea of what is to be there. This is important, where it was done. Now, you don't mention the name of the hospital, but you should mention a tertiary care or a teaching hospital or a rural setting or community. That should be there. You will see that when you look at the articles that are there, they don't mention the name of an institution, but the country maybe would be there. For us, from when the people from West publish, they don't even mention the country, right? They take it that it's there. But when we are doing it, it's better to mention from a developing country or from Pakistan. Who is important? Adults, children, what age group, males, females. That is generally part of the things. Patients with this disease or with this condition. When it was done is not really there. Right. So I just wanted to go through this, look at the articles, see what are there in different titles. That will give you a better guidance of how to phrase your own thing. And then you just maybe prioritize the articles from most to least and compare it with the others. We do it as a workshop within our setting, and that helps, brings about more discussion. Abstract, very much there. How many words are there? You don't really have to count them, but estimated count how many words are there in a line, how many lines are there, and you can just get that. If you have it as a word copy, it will get that. Objective or aim, was it really specifically stated? You don't need any references or anything. In the method section, these are the things that must be there. And people neglect that. And trying to get that into 2 or 3 sentences is also a really art, right? So try to get as much of that and see how many of these things are given in abstracts from good journals, right? Abstracts will be structured, right? So aim, methods, results, and discussion. Results, total number, descriptive, statistics, inferential statistics, results. This is in the abstract part. And the conclusion, right? Are they concerned? These are just based on it. And which abstract seems appropriate to you. Okay. And I'll just show the other final thing that I have, that is introduction. We have done similar one for discussion as well. But please just have a look at this. I found this to be a very useful tool. And if you look at it, you'll find that there's a great consistency. And most people don't. This is something we developed over here. Just take 5 articles, keep them in front of you. How many paragraphs are there? Which one is the shortest? Which one is the longest? This will help you in structuring your own writing. See where is the rationale given. That is the reason for doing the study. That must be there. It is usually the last or maybe the second last paragraph. Is the aim given in the last paragraph? Then one thing that I have added, and you will observe this, how many references are there in the introduction? You don't really have to count each one of them. If it's a Vancouver numbered style, you just read the last number that is given in the introduction section. Then what is the total number of references? Look at the end of the article. And my observation is that about 2/3 of the total references are given in the introduction and 1/3 are added later on. And this is something that new writers sometimes tend to. They put all the introductions references here in the introduction and then miss out on them. Right. So I will send all of these by email to Ms. Seaman, and then I think you can all distribute it within that. Thank you.
Thank you so much, sir. I'm gonna speak from my experience. Someone who's currently working on a research position and is currently in process of developing different research proposals. This has to be a session that was my favorite, and I got to learn so much. Um, if there are any questions that the audience want to ask, so we do have 5 minutes. Otherwise, we're gonna end up with the session.
And they can always email me. I'll send you, you can share my email and my WhatsApp number with them. So, but anyone who is writing, please just mention the reference to this workshop, or they can send it through you as well, right? So I'd be happy to respond. I've spent 15 years helping the Saudi population. I've really missed out on working with groups in Pakistan. Um, so I'd be really happy to work with anyone that is there to answer any questions that are there.
So I shared the email in the chat.